only for business owners and anybody who has corporation. Am I correct?
Difficult to talk about a health spending account without also considering what a group insurance product is. A group insurance product is...
What is the difference between FlexSave and group insurance? So in group insurance, whatever coverage is there.
If we take that same example and look at a group insurance plan, I might be able to claim that $1,500.
You are self-employed. You are a business owner. Of course, you need health and dental plans. You need health spending accounts. Shelley Moore, my guest in today's podcast, talked about how business owners can have these plans in their corporation and deduct them as an expense. Hi, welcome to Simple Wealth Wisdom Podcast. I'm your host, Gakhar. Each week, I bring simple financial security ideas for successful business owners and professionals like you to help you build and maintain your lifestyle and legacy. As an insurance and investment advisor, I work with business owners and self-employed professionals. I see a lot of you are always looking for tax advice, accounting advice, legal, estate planning, and investment advice. And when I work with you all, I always work with a team of lawyers, accountants, estate planners, and investment advisors. As your trusted advisor, I want to make sure that I bring the best to you. You usually hear everything from me, but now I feel through this podcast, I can bring all those people here who are my support system, and you can hear directly from them. This is the reason I started this podcast, where business owners and self-employed professionals like you can always go and get the ideas and answers to their questions regarding how they can protect and grow their wealth in the most tax-efficient manner. Again, being an insurance and investment advisor and very specifically working with business owners and self-employed professionals, I feel each guest will bring a lot of value to you all. And today, I'm very excited to say that I have Shelley Moore from Hub Financial as my guest. Welcome, Shelley.
Thank you, Sim. I'm excited to be here.
Thank you so much for coming here. Shelley is a vice president of FlexSave and Group Solutions at Hub Financial, and she has over 30 years of experience in financial services. Wow, that's a lot. 3 decades.
I was only 10.
That's what I was going to ask you.
Yeah.
Shelley is responsible for the Hub Financial FlexSave product marketing and sales areas, as well as supporting group benefit solution implementation at Hub. Hub is an MGA. Shelley's main focus is helping Hub advisors like me, I'm an advisor with Hub, and my clients in setting up FlexSave and group insurance plans. She has a unique way of simplifying complex ideas, and she enjoys helping business owners and self-employed clients like you to find solutions that work. And as you are running your own practice, you have your own business, Shelley is going to provide us with a lot of knowledge how FlexSave or group benefit plans can help them. So once again, welcome, Shelley, and thank you for coming here.
Thank you, Sim.
I want to make it very simple because I've given your introduction and maybe a lot of them don't even know what is FlexSave. So let's start with that, Shelley, and let the viewers know what is FlexSave.
Absolutely. Good way to start. FlexSave is Hub Financial's proprietary product. It is a health spending account. By contract or by administrative agreement, we're a private health services plan, which is defined in CRA's, all of their papers, as to what a private health services plan is and what it can do. The simplest way to describe it is that FlexSave is an account that an incorporated business sets up and uses to reimburse their employees and themselves for their medical expenses.
Okay.
Similarly to a group plan, but very different in terms of how it operates. It is an account that will allow people to get their after-tax dollars back in their pocket to use for other important things.
Okay, so you said this is something which business owners can set up. So that means FlexSave is only for business owners and anybody who has corporation. Am I correct?
You are correct. So the primary qualifier is that a business has to be incorporated,
Okay.
and then we are able to provide a benefit limit to the employees, including the shareholder of the business.
Okay.
We can set up an account for an unincorporated business, but there are more rules around what that unincorporated business needs to look like.
Okay.
At the end of the day, if you are an unincorporated business owner and have at least one employee who is not related to you,
Mm-hmm.
then we can set up an account and include both of you on that.
Okay, so that's another thing. But right now, you think most of the times you look at it as incorporated business owners.
Absolutely, if you're
And-
incorporated.
Yes. And Shelley, you mentioned the word group insurance.
Right.
We started with what is FlexCare, and now you mentioned group insurance.
Mhm.
So, what is group insurance?
Good question. It's difficult to talk about a health spending account without also considering what a group insurance product is. A group insurance product is something that an employer takes out to help themselves and their employees pay for their medical and dental expenses.
Okay.
Typically, those programs also come bundled with other types of coverage: travel insurance, life insurance, long-term disability. They are different from a health spending account
Okay.
in that you are always paying a set premium for that coverage, regardless of how much people use it, and it provides a very broad group of coverages.
Okay, so group insurance is for the group of people that are working with an employer.
Yes.
And group insurance, what according to you is that, like when you go to a doctor, when you go to a pharmacist and you buy the medicines, you have to pay it from your side for the medical prescriptions and everything. When you have a group insurance plan, and that plan can cover your medicines, your glasses, and different things, so you can set this up. And the employer pays a fixed premium for that, and that is called a group insurance, right?
Absolutely. Very similarly, that health spending account that I talked to you about would reimburse people in the same manner, but it's usually up to a specified maximum dollar amount, which is one of the ways an employer can control the cost of the program. But similarly, if I had a health spending account and I went to the dentist and I paid for that treatment with the dentist, I would then claim it through the health spending account and get my dollars back in my pocket.
Okay, so make it a little more clear. Now, this is the answer to my next question, Shelley, which I was thinking about asking is, what is the difference between FlexSave and group insurance? So in group insurance, whatever coverage is there from the group insurance plan, client is straight away using that. But in health spending account, which is called FlexCare by Hub, here, whatever money they spend, if let's say an employee goes to the pharmacist and buys a medicine for $300, employee gets the bill for $300 and give it to the employer, and employer has set a definite amount for that particular employee, so the employee gets reimbursed. Is this something how it works, or what is Hub's role in that?
I think that was a good start at looking at how it works. If I have a health spending account and I go to the drugstore and my prescription is $300, I'm going to pay that $300. With FlexSave, I would then go online to an online portal and submit that expense to Hub. The business will fund the reimbursement of that claim back to the employee.
Okay.
Usually there is a limit on these accounts. So I, as an employer, might decide I'm going to give each of my employees a $1,500 maximum.
Okay.
They can be reimbursed up to that $1,500 every year.
Okay.
And then that is the end of the benefit that is provided to them. If we take that same example and look at a group insurance plan, I might be able to claim that $1,500, but then I also might be able to claim $2,000 for my dentist.
Mm-hmm.
I may also be able to spend $500 for my practitioners.
Right.
But you're going to pay for that level of protection because there is a price for everything that you want to then include under the program. So FlexSave has a set dollar amount. A group insurance plan has a much broader insurance amount. And then that points into cost. So if we're going to buy a traditional plan, it's probably going to cost us a lot more than what a health spending account would cost.
And the way you were telling, what I'm understanding is that if, let's say, your group insurance plan gives you for a particular, let's say for teeth, for dentists, it gives you $500. but your bill is $1,000. If you have a health spending account, you can spend $1,000, all your money towards one thing also. Is it right?
Yeah, that's absolutely true. It's interesting that with a health spending account, sometimes people look at that and think, oh, I have to decide, am I going to have a group insurance plan or am I going to have a health spending account? Like the two are mutually exclusive, but they're not mutually exclusive. I can have a very efficiently priced group insurance plan and then also have a health spending account so that anything that wasn't covered under the group plan, I can then push through the health spending account and not have to pay a more expensive premium under the group plan to have those things included. Things like orthodontics, which are very expensive and coverage for them is expensive. Maybe glasses, right? To add the coverage for glasses on your group plan is going to cost more premium. So there are some things that we can push out to the health spending account.
Wow. So what I'm understanding now is, Shelley, that you're saying that people can have a group insurance and health spending account both.
Absolutely.
And whatever there's copay or whatever extra money that they're paying on the group insurance, they don't have to pay that out of pocket. That can be taken care of. So that means employer is buying both for the employees.
Yes, absolutely.
An employer can make a choice that he can give health spending account to these, and group to everyone, or whatever choice employer can make.
For sure. You know, some interesting cases that I've seen would include a business who already has a group insurance plan. And for everybody's information, a group insurance plan comes up for renewal every year.
Right.
Which means the company is going to look at your group insurance plan and say, how much premium did you spend? And how many claims have we reimbursed? And if the ratio is too high on claims paid versus premiums in the door, you're going to get an increase. And there usually is an increase. I think it's very rare that we wouldn't see an increase.
I see it all the time, yeah.
So sometimes some employers will look at that and say, what are the things that are driving up the cost of my group insurance program? Is it one or two employees who are really spending a lot in a certain area and that's having a big impact on us? What if we were to take that out of the group plan, not cover it there, and only cover it in the health spending account where we know our maximum spend
would be controlled?
Yes, absolutely.
Wow, that's a good way, I think. I don't think a lot of people know about it. I mean, I myself didn't know that. So thank you so much for sharing that. Okay, so now you've used the word health spending account, Shelley, and you have mentioned about FlexSave also. I want my viewers to know the difference between FlexSave and health spending account, because from my understanding, Hub's product of health spending account is called FlexSave. Am I correct?
Yes, you are correct. In this industry, we throw around so many terms that sometimes are interchangeable. FlexSave is Hub's health spending account. It is a private health services plan by definition under government rules. So FlexSave is our health spending account.
Okay, and you've already said it once, and I just want you to say it once again to me. How is it different from a group benefit program from the employer's point of view? My business owners and my self-employed professional clients, for them, how is it different if they are taking a health spending account, FlexSave account? How is it different from a group insurance? You did mention a few things already, but if you can provide a little more details so that they can understand.
I think that the most important difference, at least from a small business perspective, is predictable cost. So if I have 5 employees and the maximum I set for them is $2,000 a year, I know that my maximum cost to my business is going to be 2,000 times 5 plus fees, and that's it. I don't have that variable cost depending on my claims experience. So I'm able to much more easily predict. On top of that, I think one of the cool things about a health spending account is you only pay for what you use. So if the business owner sets up an account that could potentially fund $10,000 in claims, and there's only $2,000 worth of claims, they only pay for that $2,000 worth of claims. So we have an opportunity here to come in under the budget expectation that we've set for our benefit program.
So what happens to the $8,000?
So
to the employees, because they could have taken it, but they didn't take it. So what happens to 8,000? Do they have the authority to carry forward to the next year that they can use it, or what happens? Or is it gone?
So yes, absolutely. We do offer two options to an employer, and it is their choice. Some employers decide, you know what, if I can come in under my budget, I'd rather that, and I don't want to double up on it next year.
Right.
So you use the 2,000 I gave you, or it doesn't matter, at the end of the year, you reset to a brand new 2,000.
Okay.
Other employers, I think, are trying to maximize the protection that they can give to those people who work for them.
Right.
So they want it to carry forward. So if you don't use it all this year, for 1 year next year, you can have some extra.
And this is a very good tool, I think, for employee retention also, because you really, when you provide them with these benefits, it really helps. Absolutely. So now you've told about group benefits as well as FlexSave. Can an employer have both of them? Then that means, to my understanding, that should they have both? What do you think? If somebody is running a business, they have, a few very executive people, and others are just, he wants to give 1,500 to everyone, and he wants to take 5,000 for people who are the main key people, and then, VPs and CEOs. Do you think they should have both for the top gear people, or just one?
Okay, so I think it's important to know that we can differentiate between classes of employees using either the group benefit program or the health spending account. Some employers actually will decide, I'm going to give everybody a traditional group benefit program, but for my top key people who are most important to my business, I'm going to give them a health spending account as well, to give them a different class of benefits than just my full-time employees.
So that becomes very cost effective for the employer, and the employees who are at a higher class feel better as well because they got something extra.
For sure, and I don't want to pretend that employee retention isn't important for those higher end, for the executive team of company. If anything, I would say it's just as, if not more important, that those key people who are central to our business,
Absolutely.
that we're able to compensate them and keep them with us. We have had some companies come and set up a health spending account for everybody just because they were hiring a new key person and they knew they had to be able to offer them a benefit to come and join their firm.
Absolutely, very important, and I think this is a great point for that. So you think that employers do need, if they want, they can have both?
Yeah, sure.
Which is very good. All right. So how should an employer decide which one to implement and when? Should they have, if somebody is a new startup, not a business as a startup, if somebody's business is there, let's say for the past 10, 15 years, but this is the first time they're taking the group benefits or health spending account, FlexSave, where should they start?
Right. So I think the first thing that I always think is important is to take a look at our reasons behind wanting to do it. Because I think that the reasons why we might want to put a program like this in place are really going to drive us as to what's more important or what is the better product for us to set up. Some employers will set up a health spending account as their first way until they can get a handle on what claims might look like and whether or not that's sufficient to meet their needs before moving into a more comprehensive package. But again, I think it's important to recognize what's the motivator. Are we trying to compete against other companies who offer comprehensive benefit programs? Do we feel we just need to give employees something so that they feel they're being better protected? Or is it really about us, right?
Yeah.
I want to have, as the business owner, somewhere I can put my expenses.
Right.
And in order to do that, I'm going to have to give something to my employees as well. So motivation is everything.
And that brings a question to my mind that if a business owner has employees over the age of 55, and most of them at that time would have more claims, and when you're that age, chances are that you've got some meds to take regularly, there is teeth work needs to be done, with the time. So do you think at that time group plan is better than health spending account, or no, it doesn't matter? To start with, I'm not talking about, of course, health spending is totally different, but what do you think?
Well, that's a really good question, and sometimes, Sim, and I hope this answers it the way you need me to, sometimes it's a cost decision. Sometimes it's an out-of-pocket decision. If a group plan is going to cost me $30,000 a year, but I could provide some level of benefits for 10, maybe my cash flow is going to be the thing that decides whether or not I go for a full program versus a health spending account. How risk adverse am I? Just like you might talk to somebody about with regards to their insurance or their investments, being risk adverse may mean that I don't have the capacity to be able to stomach increasing premiums if people really use the policy we've bought them. So just understanding where I stand from a financial point of view is going to help me make that decision.
Very good. And now, business owners are business owners. They are in the business to make money. And when they make money, they pay tax. And nobody wants to pay tax. But we have to pay tax, right? So this is the reality.
Yeah.
Having a health spending account, flex save account, is there any benefits to the employer for their tax?
So the biggest advantage for an employer from a tax perspective is that the money I pay into the flex save account, just like with the group as well, the money I pay in is a business expense to my business.
100% full?
So let me break it down for you. If there's a $100 claim, I'll use nice easy math. $100 claim, that is 100% deduction. There would be a $10 administration fee.
Okay.
That is a very direct deduction
10%.
as well. We have a lovely 11.5 total tax here in Ontario that applies as well.
Okay.
That would not be a direct business expense, but then their accountant can determine if they get some tax credits back based on that.
Okay. So otherwise, that $100 is a business expense to the business.
Yes, it is.
That is paid for employees' expense, whatever he's used from the health spending account.
Yes, it is. And those employees will get their reimbursements back tax-free.
Okay, it's not taxable income to the employee at all.
It is not a taxable income. It is not taxable benefit. It's
Wonderful.
tax-free.
Wonderful.
Yeah.
So, do employees actually contribute to health spending account?
Usually not. That's probably another distinct difference between a health spending account and a group program.
I was coming to group benefit, and I know that a lot of employers ask employees to pay, so I wanted to know what is the difference here.
Yeah. So usually with a health spending account, it because it's a flat dollar benefit amount and there's a fee on top of that, it doesn't actually make sense for an employee to contribute a piece of that, because then they're actually spending a little bit more because of the fee. So employers usually set up those accounts. They can vary the copay. So what I mean by this is if an employer says, well, I want my employee to have some skin in the game. I want it to cost them something. So instead of giving you back your full $100, we're going to give you back $80.
Okay, so just like group insurance plans have a copay,
Yep.
so they can set up, but in most cases, do they do that?
No.
They
In
don't.
most cases,
They
the
don't do
company
it.
says, this is my budget.
And use it the way you want.
Use it the way you want, and at the end of the day, once you're done spending it, you're done.
And if somebody wants to use all the money to go to a therapist or all the money to get the massages done, they can use it. They use their whole account. It doesn't restrict them for anything in particular.
We don't restrict them unless an employer decides they want to.
So employer has an option.
The employer does have an option. I think most of our clients don't differentiate between the kinds of spending that their employees do.
Okay.
They've set their budget and that's it.
And they'll-
But some employers want to tailor it a little bit more. So if we take that same $1,500 limit I talked about, we'll give you $500 for prescriptions, $500 for massage and physio, $500 for dental, and each of them has their own maximum.
Okay, perfect. That makes sense. So this is lovely. I'm sure a lot of people are liking it. And this is a question which is coming from my clients, and they want to know, is there a minimum number of employees that they need to start the Flex Save or group insurance plan?
So qualifying for a FlexSave account or for a health spending account is a much simpler process. Once we reach that check mark that says, yes, I'm an incorporated business, I can set it up. You don't have to have a minimum number of employees. You don't have to have been in business for at least a year. And we can also include part-time or seasonal employees on a FlexSave account, which is something very different than group.
Yeah, in group you cannot. That's
No.
right.
Yeah.
Okay. So for the group insurance, there has to be a minimum number of employees? Do they need to have a minimum number of employees to start that?
The carrier that we work with right now has a minimum of 2 employees.
So 2 employees can be the person who started the business and his spouse who's doing the admin work, or does it have to be arm's length?
It doesn't have to be arm's length, but they both have to be salaried employees.
Okay, so both are taking, that means the person, the main owner of the business can be a part of that.
Yes.
Okay, I'm asking it for the clients who are lawyers. Let's say a lawyer is working and lawyer has got one assistant and just 2 of them, and they want plans so they can do that.
Yes.
Very good. What happens next year? What happens at the time of the renewal now? Group insurance, you've already talked about
Yeah.
it, that they can either carry forward or they can decide it at the beginning. But in the group insurance, you talked something about experience
Right.
based on used. So how do you suggest people? I would like a suggestion from you.
With a group insurance policy, every year, shortly before the renewal date,
Yeah.
you as well as your clients would get a statement or a renewal report that shows how much premiums you've paid into the policy and how many claims have paid out.
Okay.
When we establish a group policy, we have what's called a claims ratio.
Right.
And the insurance company says, as long as, and I'll use this number just as an example, as long as we don't use more than 75% of your premium to pay claims, you shouldn't have a big increase.
Okay.
But the more we spend on claims as an insurance company, the more we're going to increase your renewals next year.
Is it proportionate? Like if the experience of claim was 3 times and the premium will increase 3 times, or it's not proportional?
I wouldn't say that it's proportional, no. And I mean, there is definitely a percentage,
Okay.
but there are other things factored into those
Yeah.
increases, like industry experience,
Yes,
market volatility,
Yeah.
all kinds of stuff.
Absolutely, absolutely. So now, my employees, somebody's, let's say a business owner took the group insurance plan or health spending account plan. Would that cover their spouses or their children or just the employees?
So again, with FlexSave, there's so many choices that an employer needs to make. Our default is that if you have a spouse or children, that they are included and you share your maximum benefit amount with
Okay.
them.
Okay.
Some employers don't want employees to add spouses or children to their plans. I think it's pretty rare. But if someone said, you know what, I only want it to be for my employees and to not have other claims going in, we might want to take that one off because it happens very rarely, so I don't want to spend time on it. Sorry.
Okay.
I wouldn't
Okay.
answer that way. Maybe
Got-
ask me again.
Okay. Cut. So, if needed, do you think employers can offer these benefits to the spouses and kids as well?
Absolutely. We see a couple of ways that happens. The first is our default, that if I'm an employee and I'm enrolled and I have a spouse and a child, we all share my benefit amount
Okay. Fair
as a
enough.
unit. Some employers like to get a little bit more creative with how they set up their account. They may say, okay, for all full-time employees who have no spouse or dependents, we're going to give you $750 a year for your medical. But if you have a spouse or children, we will increase that to $1,500 so that they're putting more in the pot for people who have children.
And that is for health spending account. What about for the group insurance? That can cover. That gives an option too.
Absolutely, yes.
Yeah. And
Yeah.
that is the employee's choice. They want the spouse or not?
No, it's usually automatic.
Automatic. Okay, perfect. And is there a minimum number of full-time or part-time employees that they need?
On a FlexSave account, on a
Yeah.
health spending account, no,
No.
not at all.
And on the group insurance plan, you said 2 people minimum. They
Yeah,
can
2
start.
people minimum.
Okay.
Yeah.
Okay. Can any business do it?
As long as the business from a FlexSave perspective is incorporated,
Yeah.
then they can set up an account.
Wonderful. And now let's talk. This is my last question. I know I've asked you so many questions and you've been so good, Shelley, seriously. But let's talk this question. Let's talk about a small boutique law firm, okay? And they, or maybe an accounting firm, they have 3 to 4 employees and they want to set up something. What do you suggest? Where should they begin?
I think for a smaller size business like that, having a health spending account gives them loads of flexibility. If they've never done something like this, it also gives you an opportunity to see how heavy claims are going to be and evaluate your position a couple of years down the road, right? So setting up a health spending account for all of those employees, I think, is a great way to start.
Yeah. And you mentioned this earlier too. So can businesses do it themselves?
I would not suggest that a business do this themselves. And we've actually had some people say that, well, why would I pay you 10% to do this
Yeah.
as our administration fee? I could just do it myself. The first thing I will suggest is, that's my opinion, that if I as a business directly reimburse my employees their medical expenses, that makes it a taxable benefit for them when I do so.
Right.
I think that there's another matter that concerns me even more than that, and it's the privacy of that employee, right?
Yes.
That if we're going to reimburse our employees directly for medical expenses, we're going to be privy to a lot of personal medical information that I think is protected from a privacy perspective.
Yes.
Having a third-party administrator like Hub enables an employer to do this without violating privacy
Right.
in a way that we can be sure is compliant with CRA rules and makes decisions on eligible claims based on legislation.
Wonderful. I think that's very informative. And I'm sure that business owners, self-employed professionals, they all are very clear after you've explained in very, very simple language the difference between health spending account and group insurance, who should have it, why should have it, how many employees, how long in business. You've answered almost everything. But still, I know I'm going to get a lot of more questions, and I will have to have you here again, Shelly.
That's good.
Thank you so
Thank
much.
you.
That was very kind of you.
Thanks, Sim.
And thank you very much. This has been very informative, very helpful for all of us. Thank you for coming once again.
Thank you.
And that was another episode of the Simple Wealth Wisdom podcast. Please let us know in the comments what you like the most about this podcast and if there's anything else you want to see or ask, and I'll make sure to bring that to you in our future podcast. Watch for us again next week. Until next time, stay safe. I'm Sim Gakhar. Thank you.